These are the numbers that so far congressional Democrats, the White House, and the media are not talking about. The reason? Well, they show the health care cost estimates beyond the 10-year mark. These are where the costs are projected to go after this administration has left the White House and this Congress is just a memory.
Well, it took some digging from our team out of Washington to find these numbers. Bill Salmon leads our coverage. Bill, good morning to you. Bill's the Washington managing editor for us here and the vice president of news. Where do we get these numbers, Bill?
These are from the Republican staff on the House Ways and Means Committee, and they are in direct contradiction to what the President of the United States asserted last night repeatedly. In his opening remarks last night, President Obama said, quote, "Health insurance reform will not add to our deficit over the next decade, and I mean it," end quote. By the way, that over the next decade is a key phrase. Later on in the press conference, he didn't use that qualifier. He just said, you know, I know people are talking about the deficit going up. Healthcare reform is going to make the deficit go down. And these new statistics from the Republicans on the House Ways and Means Committee show that, for example, over a 10-year period, they claim, the Republicans claim, healthcare reform will add $769 billion over a 10-year period to the deficit.
That's a pile that's too high for us to even show on a graph, quite literally. Do Democrats, do they oppose these numbers coming out? What have they said about that?
Well, all I ever hear from the press is the president's assertion that the deficit numbers won't go up, and I haven't really actually seen much reporting on this other than us, since we're the first ones to get this. So I haven't seen the Democratic reaction. But what's interesting about what the Democrats are saying is if you look at their proposal, one of the reasons they get away with this sleight of hand is that they actually have taxes, the tax hikes that they're talking about, surcharge on the wealthy, actually would kick in 2 years before the health care benefits would start to phase in, and 4 years before the health care benefits would fully phase in. So in other words, you've got 2 to 4 years of all these additional tax revenues coming in before they're spent on anything, and only then do they begin to spend it. And that's, I think, what masks some of the out-year increases in deficit spending.